Welcome to the webinar. Our topic today is how to get relief from neck and shoulder pain. This 25-minute webinar, followed by a Q&A session, promises to be an enlightening experience for anyone suffering from or interested in learning about neck and shoulder pain. Our expert chiropractors from Cianci Chiropractic will delve into the root causes of this discomfort and offer practical advice on managing and alleviating these conditions. Please type your questions in the chat and we will get to them at the end of the webinar. And at any time during this presentation, you are welcome to call the office for an appointment at 410-210-4562 or visit the site at drcianci.com, and that's drcianci.com, and book online. With that, I'll hand it over to the presentation to Dr. Cianci. Please go ahead.
Thank you, Jen. Couple things. We feel like we have a lot to cover here. I'll lay out some of the top three things we're going to be going over with regard to neck and shoulder issues, what I've seen over the years, 33 years in practice coming up here in another month or so. Three things we want to go over is, number one, why are we talking about this topic? Why are we talking about it now? I'll go over some of the things I've learned over the years. Who's at stake, so to speak? Who tends to be affected? We'll cover that. And then lastly, what can you do about it? So we'll talk about some of what we do about it clinically, but we'll also talk about some, towards the end, we'll have some self-help tips. We have some short 2 to 3 minute YouTube videos that go over some things you can easily do at home to also combat these things. So again, over the years, I've seen more and more things change with regard to patients. Clinically, we hear different things. From a history standpoint, we hear different things from patients. Neck and shoulder issues are something we hear from patients every day, really, to some degree. And the thought process came up as to, why would we do this webinar, so to speak? And it's because we're seeing more and more of it. We'll talk a little bit about that. When we talk about neck and shoulder issues, we very often talk about some of the myths we sometimes hear. We'll be at a social event, and if someone finds out I'm a chiropractor, Dr. Julie is a chiropractor, Dr. Bill Hour's a chiropractor, it isn't long before very often as you introduce to that person, the person will actually grab their shoulder, and they don't say anything, but they just kind of grab their neck and shoulder area, and it's almost a hidden sign, if you will, that they're experiencing some issues, or they wish they had some answers to it. Or they might say things like, well, I have this issue in my neck. Do you mind talking about this? And we generally say, well, we love our job, so we don't mind talking about it. And they'll ask different questions. And one of the things sometimes patients will say is, my muscles are really kind of tight right here. I think I need a massage. And we're all fans of massage. We recommend massage therapists to patients here in the office, and to have that done because we think it's beneficial. But very often the cases we see are things that have lasted maybe more than a day or two. You can have a stiff neck and get a massage, and massage may help you with that. But the things we see generally go further than that. Various massage therapists will send patients to us because, again, they realize as a therapist that there's something more going on here that's leading to neck and shoulder issues. Another myth, so to speak, we hear from patients is patients will say, these are kind of my stress points right through here. When I get stressed, that's where I happen to notice it. And if I could just get rid of the stress, if my job gets me stressed out, or my kids get me stressed out, and that leads to these areas right here being tight, if I could just get rid of the stress. And I might smile under my mouth, if you will, because again, oftentimes the problems, at least that we see, stress doesn't really cause the problem. It turns up the volume on a problem that's there. It just makes things more prominent, if you will. And the second part of the smirk, if you will, that I might have on my face might be that stress doesn't really go away. Yes, there's times when you're more stressed, but stress isn't going away. I see a lot of patients who are retired. They thought the stress would go away when they retired, and it didn't. It's still there. Maybe it's a little different now than it was when they were, say, in business or something. But so again, stress alone doesn't cause a problem. It just makes things worse that happen to already be there. More and more people have neck and shoulder issues. I've seen this trend over the last 30 plus years. So it's more and more people have that. There's some things that changed that made it more prominent. One other item we like to go through a philosophical approach, if you will, with regard to neck and shoulder issues. Sure, lots of people can have those issues. It's just something that people have nowadays. What we do is we liken that to poor vision. Research tells us that about 65% of the population has poor vision, meaning they need glasses, they need contacts, they need some sort of correction, if you will, to improve their vision. So poor vision isn't normal, it's just common. And we look at neck and shoulder issues the same. Well, doesn't everybody have a stiff neck? And well, a lot of people can have it, it doesn't make it normal. We don't let people drive down the highway without corrected vision. If we have the ability to help a person's vision, we work on that. Imagine, if you will, if we didn't. Driving down the highway, people couldn't read exit signs. They may not be able to read their GPS as to know when they're going to make a turn or exactly where to make a turn. So the idea that we just, well, a lot of people have neck and shoulder issues, just leave it there. Common doesn't mean normal. We tend to fix things that we can, and again, neck and shoulder issues are easily fixable if you diagnose them correctly in the beginning. So that's something to think about. Another thing we also talk about is the fact that we check the neck on every patient. We check the entire spine on every patient, but we certainly look at the neck a little more closely if a person has neck and shoulder issues. But we always, if we have a neck issue, we check the shoulder, and if we have a shoulder issue, we check the neck. The nerves that go there will go to the rotator cuff. The nerves out of the neck go to the rotator cuff. So we're certainly going to check all those areas. We look at that together. And even if a person doesn't have symptoms there, they may have sciatica or a disc problem. It doesn't matter. We check it. We think it's that important, and we think it's that important that it gets addressed. So we check all those things no matter what. I also look over my career, 30 plus years, and I think of some other things that have happened, advancements, if you will, in technology that are great and wonderful and we use every day, but they also lead to more problems. Some of you, if you're younger, might laugh at this, but kind of in the late 80s, early 90s, there was something that was created. It was a laptop computer. So instead of the great big monitor that you had on your desk, this was a laptop, if you will. It was kind of cool. It was kind of neat. You could fold it up and put it in a briefcase. And so that certainly has changed. Back then, people would be in the airport and they might be typing something up, doing some word processing, but they might do that while they were waiting for a flight. And that's kind of what a laptop was used for. Nowadays, most people have a laptop, and we have some people working on them day after day after day. You know, so sitting there on the small screen, I'm exaggerating this so it's easier on camera, but again, getting into a bad posture, trying to read a small screen, typing on a small keypad. We advise patients to, if you have to work on a laptop in your home, let's say, get a big monitor so you can attach it to the laptop so that you're looking at a big monitor, your head's more upright than it would be hunched over a screen. We also say, hey, why don't you get a keyboard so you don't have to type on this little keyboard. I see a lot of teachers here. One thing about teachers is teachers are forever students. They're always grading papers or bending over talking to students. They have to take work home, and oftentimes they're working on a laptop, again, hunched over, maybe working at the kitchen table. So that's changed over time. More and more people working on laptops, and they're really designed for short work. They're not designed for hour after hour after hour. That leads to more stress in the neck and shoulders and leads to some of the problems we see. More and more people working from home now. Again, probably at a desk that really isn't maybe set up for them. So again, we see head and neck and shoulder issues because they're hunched over a screen hour after hour after hour. Had my truck worked on recently. The mechanic doesn't pull out a wrench, he pulls out a computer and he hooks it up to the truck. So that helps diagnose things. They can even make changes to the engine through the computer. So again, just the increased amount of computer usage, laptop usage, tablet, iPad usage, and then of course cell phones too as well. It's kind of taken over our society, if you will. We've been asked to speak at a couple different places recently. One kind of a center for lifelong learning. Another support group asked us to come speak to as well. And the presentations will be live, but they also have a Zoom component where there'll be people, not unlike this, connecting in and we'll go through our presentation. They get to do it on the computer. Again, more computer time. Years ago, people, if you had a meeting, you went to a conference room and you had a meeting together and met together. Again, more and more computer usage, more and more Zoom calls. Cell phones, if we think about that, some of you are going to laugh about this, But I remember back, we'll just say 25 years ago, cell phones were getting more and more popular. And I remember hearing parents say, maybe at a sporting event or something, yeah, we're not going to let our daughter get a cell phone until she's 16. Then when she's driving, we'll know when she gets off a lacrosse practice, and she can keep us posted by having a cell phone. We were not going to let her have one earlier than that. And then maybe the age group went down a little lower, and it was, well, when they're a teenager, they could have one. And well, again, now kids get cell phones sooner and sooner. They're reading them and looking at them all the time, getting in a bent posture, the same one you might have looking at a laptop computer, and it's changing people's structure. These are things that we see on X-ray where people change their structure. And not only that, the other day I somewhat had a smirk, if you will. I had a patient who had a 9-month-old, and the 9-month-old was watching a video on a cell phone. Fine, it keeps them distracted, if you will. But again, we're training kids even younger and younger and younger using cell phones, swiping through things, watching videos. So again, they're using them not only more often, but it's in the younger age groups, in the formative years. And that we're seeing changes, which we'll show on X-ray soon, using technology has actually created a syndrome known as tech neck. Technology that actually cause neck issues. We see it more and more all the time. So we talked about the younger age group. What I've also seen is, I remember 25 years ago, we'll just say if the person talking was mid-50s to mid-60s, I remember these statements. I will never own a cell phone. If anyone wants to get a hold of me, they can just call my home phone. Why would you ever use one? You don't need one. And again, recently I was at the Maritime Museum for a presentation. The presentation happened to be in the middle of the day. I happened to move my patient hours a little bit. It was a presentation I really wanted to see and was excited to see. So I actually moved my patients a little bit, maybe a half hour or so that I could attend the presentation and then get back to the office and get back to work. Well, on a Wednesday at 2 p.m., most anybody in the audience is probably not working. They're retired people. And I remember sitting in a seat, and then in front of me was 5 or 6 people, I'm guessing average age 70. And someone said, I just overheard, can you go to dinner on the 17th? Can we all go to dinner on the 17th? Immediately, all people, it's average age 70 years old, pulled out their cell phone, went through their calendar and looked to see if that date was going to be okay. So again, people didn't think they would use one or ever use one, using it all the time. So whether it's a young person who's getting trained at a younger age, changing the shape of their spine because of head posture, leading later to neck and shoulder issues, or if it's someone in their 70s and beyond. The thing about it is that tech isn't going away. We could say, well, don't use a computer, don't use a cell phone. It's a little unrealistic. What we're seeing more and more is that more progressive people are saying, this is a real issue. It's changing structure, which we'll show you in a minute. It's changing function and the way people feel. It's not going away, so we have to be progressive and find a way to do something to combat the neck and shoulder issues, to combat the effect of technological changes that have happened in our society. So those are some of the things that we tend to see. We've got to do something to combat the way the world has changed from an electronic standpoint. So from a clinical standpoint, what are some of the things we see? So I have in front of me here some x-rays, examples, if you will. The one on this side over here, just so you know, here's the back of a person's skull. So their shoulders would be here, and it's a side view. It's as if the x-ray was coming through the side of my neck, if you will. You'll notice that the curve forward, okay? That helps give your body cushion, shock absorption, if you will. It takes it spreads out the stress, if you will. If you go back to the Romans, they know that an arc is very, very strong. A lot of things are built on an arc. Your neck is built on an arc too. And a normal functioning neck tends to have that smooth, bendable curve forward. I'm going to do my best to try to show this as well as see this. So we want to try to maintain that curve. That would be a good normal curve. On the back, what attaches here from the back of the skull, right on down to the shoulders and neck, is a lot of muscles, tendons, ligaments. They attach to the skull and they attach to the base of the neck. In this curved picture here, normal, there's less stress on the soft tissues, ligaments, tendons, muscles, that connection. And if you look over here on this side, you can see the neck is flattened out, it's actually bent the opposite way. So again, we're putting a lot more stress on the muscles and ligaments and things that attach to the skull and attach to the shoulder and neck. This happens from forward head posture, cell phones, computers, studying, schoolwork. Teachers forever have homework, they're working day and working night. So those are the things we tend to see. It puts more stress on the discs, and we end up seeing structural changes with patients. We see the early onset of arthritis. Had a patient come in recently, 27 years old, happened to bring their mother with them. I told them they have some arthritis in their neck. Mom couldn't believe it. How could she have arthritis at age 27? Well, she's probably been on a computer most of her life, and she's been to college. And again, these are the things we tend to see, and we're seeing it more in younger and younger age groups. So again, these are things we happen to see. Off here, again, to the side, I mentioned in the beginning that there's ligaments that attach to the base of the skull. We're actually seeing in some cases where it attaches to the base of the skull, almost a spur, if you will, grows there. You may have heard of a heel spur. Heel spur happens in the bottom of your heel if the ligaments, tendons, and muscles where they attach to the heel get stressed or pulled on year after year after year. It'll actually build a spur. You may have heard that before. Well, the same thing can happen up here in the skull, where we actually can see a formation of an actual spur there too as well. That's chronic pulling on the skull, and it actually leading to problems. And again, we see this more and more, and we're seeing some of this in younger and younger populations. So that's that. This one here, we have patients come into our office who say, I looked at myself at the pictures at a wedding the other day, and I noticed I have kind of a hump. I didn't realize that my neck is humping over, and I feel like I have a lump there. And I know grandma or my great aunt has a humped neck, and I don't want to look like that. Again, long-term stress on your neck, time and time again, uncorrected, can lead to things like that. We see that too as well. I know Dr. Julia did an internship in Washington, D.C., and it wasn't uncommon for people to come in and say, I got this hump here. I'm 32. Why is it there? Again, it's part of what we've discussed here today. So that's some of the things we see on X-ray. Some of the things we want to talk about is the process. Like, what do we do about it? We're kind of at that stage. What do we do about this thing? A couple of things with regard to neck and shoulder issues. When a person has an issue, there's a few things we want to find out. Number one, we do a history on them. We find out everything about them medically, whether they have diabetes or not, and are your parents alive, and what sort of back history do they have. Obviously, we'd find out if it was a neck and shoulder complaint, what's involved, how long has it been there, does it affect your work? Are you going to keep the job? You work at a computer 8 hours a day. Are you going to keep that job so you're continually subject to that physical stress? But an entire health history would be one of the first things we would do. One of the next things we would do would be some nerve testing. We have instruments in our office to measure nerve function. We can see how the nerves are affected. Again, the nerves make the muscles tighter. We've got a bit of an example here of a nerve test, if you will. I'm going to do my best to see this and point some things out. What you need to know is on this particular side over here, we want to see as much white as possible. And as the colors change, it means a different amount of stress, a different amount of muscle contraction on the muscles. Again, you can see lots of reds and lots of different colors. This person obviously has tight musculature in their neck too as well. And these are something we look at initially, and then we look at throughout care so we can tell progress by things we can measure, not just things we just guess about. Patients who come to us, we can bet they haven't perhaps had this testing done before locally, because I'm not aware of anyone in the area that has the same technology that we have for doing that. So again, that's some of the testing that we do. We can get objective evidence on it. Another thing we do and look at with patients, I mentioned arthritis earlier. Arthritis is really, osteoarthritis is really just wear and tear arthritis. It's you put stress on a bone long enough, it will change. I've got a little model here that shows some of that very simply. Again, to this side over here, the spine should have big, thick discs present. You'll notice on the side, the nerves come out the side here. So when the spine is lined up appropriately, we've got good, thick spacing. When a person gets out of alignment, keep in mind they may be training themselves day in and day out with computers and cell phones. what tends to happen over time is that the discs get thinner, eventually maybe leading to this. And we often kind of show the normal versus this one. It's a little easier to see, but you can see some of the spacing has changed here. It's thinner. We've got some spurs starting to form. They can form in the neck. They can form in the spine. The same ones we talked about with regard to the heels, that can happen. That same process can happen in the spine. And we look at that, we're seeing this more and more again in younger populations. So again, these are the things we look at with regard to x-ray. So getting back to the process itself, so consultation, history, examination, neurological testing we do, orthopedic testing we do, the computerized testing we do as well. Then a person has x-rays, so we can really assess structure and function. How are those things affected? Later that night, our doctors all sit down and study and analyze the films and the findings. And our goal is to answer 4 questions for people. Most important question, are you in the right place? Is this something we can help you with? So that's number 1. If we feel like we can help, then there's 3 other things we want to answer. Yes, we can help. What's wrong? Explain it to you. How long will it take? How much will it cost? Those are the 4 questions most people want to know, and we sit down and lay that out. We may also, too, the doctors may get together and say, well, we want to do chiropractic adjustments, but we also want to add an exercise program in, a rehabilitative exercise program because of the structure changes. Care is dictated based on what a person ends up having with regard to the findings. That would dictate all of it. With regard to care, so we have some patients who absolutely love kind of manual adjustments. They love when they get their necks moved and their whole spine moved. They may hear some popping or clicking. Some people love that and look forward to it. I would say most people do. Then there's a percentage of patients who don't really want to hear popping and clicking. Thankfully, we have a lot of different other techniques we can do that get great results on issues. But again, taking into account that some people don't want to know and feel that. I don't go to my dentist, and I don't really love when the dental hygienist scrapes my teeth. They have another technique. They use an ultrasound machine, which does phenomenally well, but it's more comfortable for me. That's just one of my things that I like. We obviously have patients that want the same thing with their spine. We've got various different techniques. Dr. Julia's skilled in a lot of those softer techniques. So whether a person's wants to do the kind of older fashioned manual techniques, we can do that. And there's a variety of other different softer techniques that can be used. Most people end up loving being taken care of. So again, that's kind of how that process works. I will say that too as well, we said we would list some self-help things. There'll be some links towards the bottom with regard to YouTube videos that we have. Again, 2 to 3 minute videos, things you can do at home to combat this thing. Because again, it's coming. It's more, tech isn't going away. It's getting more and more. Again, progressive people want to do something to counteract it. And some of those videos will help some of the people that want to do some things at home to also combat this. So I think you had a few questions for us, Jen.
We sure did. So thank you, Dr. Cianci. That was a great presentation. We have 6 questions lined up for you. The first one, I have had neck surgery, but I'm still having problems. Would I be a good candidate for care with your clinic?
I would say yes. The hesitation is, again, getting back. We're going to look at that history. We're going to find out what it is. We're going to look at the x-rays. In the course of a day, we'll see 6 or 8 people that have already had surgery. So can you be a candidate? Yes. Does it take a little more detail as far as history and examination? But those things tend to come up in consultation with patients. And if they happen, I think I've had one patient in 30 plus years that didn't tell us they had an operation. We did see it on x-ray, fortunately. But again, yes, they can be a candidate. And really and truly, people may be sitting there thinking, I've had surgery, I can't be a chiropractic patient. I would flip that around and say it's even more important that they get their spine checked. If you had surgery and you talk to people, it's not uncommon for someone to say, I had this segment operated on 3 years ago, but they had to go work on the one below it. I had to go back in, or I had to go and work on the one above it. Like if you've had surgery on your spine, you want to take even more care of it from a non-surgical approach. Because if you don't, the bad area, if you will just spread. So again, got to take important, careful consideration with those people. But we do these things all the time. It's a daily occurrence that we see people like that and help them quite a bit.
Great, great. The next question has to do with someone being nervous about getting their neck adjusted. I know you went through some of the softer techniques that you have in your clinic. What would you say to someone who's kind of scared to even make the appointment because they're really nervous about getting their neck adjusted? Can you talk them through anything that might make them feel a little more comfortable to come in and get seen?
Couple things with regard to that. We realize it's a sensitive topic for people. Sometimes if people are very nervous about the whole process, a person can come and schedule just a consultation. So we wouldn't plan to do exams, we wouldn't plan to do x-rays. We just hear their history and then perhaps answer some questions that they have. And sometimes that's kind of a way to ease into the process. So, hey, I have interest, I'm interested, but I have some concerns. So that's sometimes almost a stepping stone where we get the history, get the information from them, find out what their issue is, and just flat out tell them, yes, it's worth digging in deeper, or no, it's not. We've even had sometimes patients with that same scenario. We'll say, hey, listen, why don't you come in and watch a couple people get care and see if you're comfortable with it. You could even talk to some patients. Patients are usually they want to talk to people because they may have been someone like the person we're talking about who I was really nervous at first and I wasn't so sure about it. There's some things on our reviews talk about that, but if you want to talk to someone, we can have you come in, do your consultation, say, hey, why don't you talk to a few patients? They were kind of nervous when they came in too as well. We want to do everything we can to kind of bridge that gap, and those are some of the ways that we would approach that.
Okay, that's great. That's great. Next question. I think you've answered it, but let's dive a bit deeper on it. The question is, would you say you are seeing more neck problems now as opposed to 30 years ago? You talked a lot about that being due to the tech. Is there any other reasons why you think you're seeing more neck problems now?
Certainly tech is it because you start off with it in the morning and you probably, one of the last things people do at night is shut off their tech. Hopefully they do. So that's certainly part of it too as well. There's been some things with regard to backpacks and children. You know, more and more kids. I at one time would take my daughter and her friends that run a lacrosse team and pick them up at school, and we'd go practice lacrosse at an indoor facility. And I remember lifting those backpacks up to put them in my truck, and it was incredible. So again, we're putting physical stress, extra weight on a developing spine. So certainly that's a huge factor too as well. I think that's a big factor too. We think of it, well, a heavy backpack would affect their lower back. Well, it causes them to lean forward too as well. So it's a variety of things like that that are affecting people. And again, earlier and earlier in life, you know, we're seeing that. So it was incredible how heavy these backpacks were. And we put those on our kids all the time. And again, the formative years. So I think that certainly has something to do with it. One other thing, a little bit, I think the world has changed somewhat. I think we're less physical. You see less farm kids and more computer kids, and so there's not as much work done, physical work. So I think in some ways we're not as fit as we were that way, or as strong as we were that we saw years ago. So that's probably another factor. We don't split firewood and start a fire to heat up our house. We turn up a dial. We could probably do it on our phone. We could turn up the heat before we get there. So I think that's also another factor too.
Makes sense. Next question here. Why should someone without pain or a current complaint get evaluated by a chiropractor?
Again, I explain the world and all the reasons why it puts more stress on a patient. Also, too, we might have someone who comes in who's having a sciatica issue and they don't feel like the neck is affected. And we take x-rays and they look like some of the x-rays we showed you. Most of these problems too are there festering and festering and festering for years, sometimes decades before they become symptomatic. So again, the idea of getting on it ahead of time before it's an issue just basically makes sense. You know, we don't wait till our teeth hurt to brush them. We tend to do that proactively. The same thing is true with regard to a person's spine. You know, do something proactively. It's always easier to take care of. As I said, none of us are immune to this. It's part of society. It's not going away. It's going to be there whether or not you have symptoms or not. The patients who come in with symptoms, oh, I've had this going on for 3 months. We look at their x-rays and say, well, actually, the cause of it's probably been there, 10 years or more, just based on looking at x-rays. So again, you don't have to just have symptoms to have a problem. Easier to get to anything when you get at it ahead of time and just wait for it to be symptomatic.
That makes a lot of sense. Somewhat like maintenance. Is that a fair comparison?
Yep, and I think maintenance and also just being proactive. So maintenance almost. I would rather call it proactive. It's before you have a problem. It's not after you have one or just trying to maintain. A little bit different terminology.
Okay, all right, that makes sense. Next question is about frozen shoulders. So, what is a frozen shoulder, and can chiropractic care help with it? And then, could you please also explain what is a frozen shoulder for those of us that haven't heard of it yet?
Okay. So frozen shoulder, it basically means the shoulder is limited in motion, and it can be limited where a person can't lift it at all, or it could be I can lift one arm, but I can't lift the other arm. What oftentimes happens is the muscles, the rotator cuff muscles, which are part of the shoulder area, they can be shortened, they can be restricted. It could come from an injury that wasn't healed properly, and over time the mobility goes down. It can also happen from bad nerve supply. We mentioned we look at shoulder, neck, and we also look at neck, shoulder. They both can cause each other. If a person has bad nerve supply, or maybe their x-rays look like some of the ones we showed you earlier, that means that the nerves are under constant stress. They put bad nerve signals, if you will, to a muscle, and eventually the muscle shrinks up and it causes the shoulder to be quote unquote frozen. We'll probably see 8 or 10 variations of frozen shoulder in the course of a day. Some of them can't move at all. Some of them are in various stages of restriction. Gee, I can't comb my hair. I can lift my arm up, but I can't comb my hair. Some people didn't know they had weakness in their rotator cuff. Hence the reason why we check it at the beginning. No matter whether a person has a neck issue or not, we always check shoulder, rotator cuff, and that connection. But that's essentially what frozen shoulder is. Some people say, I've been told I have a frozen shoulder. I don't want to have an operation on it. One of the treatments is actually to put the person under anesthesia, not here, but medically put the person under anesthesia and force their arm up. Again, not a good thing to do with ligaments and tendons, but that can happen too as well. Frozen shoulder means any restriction in the shoulder motion. If you don't have proper motion above your head or something, you have some sort of a variation of frozen shoulder. So.
Okay. Just on that, is there anything someone can do to avoid even getting frozen shoulder in the first place?
The thing about it, are there some things you can do? Yeah, there's some videos and some of that self-help videos towards the end. We'll talk about the shoulder, neck, shoulder. So there are some self-help things they can do there too as well. I had that same smirk I had on earlier, that usually a frozen shoulder comes on so slowly, the person is less and less, say that I can lift my arm up here. Well, over time they have less and less mobility. The thing about it is, when's the last time you tested your shoulder mobility? Probably not. But all of a sudden they realize, God, I can't lift my arm up. It happens so slow, it's hard to even know that you should do some things about it. But some of those short video clips that we have would address that somewhat.
Okay, great. Thank you. We got a last question here. And it is, I don't have any shoulder pain, but I feel like the flexibility and mobility in my shoulders aren't what they used to be. Why does this happen? And can a chiropractor help? So I think this is a little different from the frozen shoulder that you're talking about. But anyways, could you help this person with their question? Sure.
Again, the fact my mobility is not as good, my flexibility is not as good, is probably the early signs of a real frozen shoulder. Hence the reason why we, as I've said several times, we look at neck, shoulder, neck. Also too as well, if you have bad nerve supply, and you wouldn't know it because you wouldn't have to necessarily have pain, it's decreased the nerve impulses to the muscle. It's not as healthy, it doesn't heal as well. Some of the tech stuff we talked about with tech neck and computers and things, it tends to pull the shoulder muscles forward. So again, if you spend most of the day on a computer typing in all the time, you tend to pull things shorter. What happens over time to muscles is they shorten. So you might say, well, God, my shoulders are just stiff. They don't move like they should. They don't move like they used to. Again, sometimes the person will say my flexibility is not as good. When I drive my car, I notice I can look to the right, but I can't really look well to the left. These are some signs that the neck and shoulder issues we talked about are starting to happen. It just isn't real obvious yet. It may not be obvious symptomatically, but it may not be obvious from a motion standpoint either as well. That's kind of more the earlier signs. There are some things that will, in the short videos, clips that we mentioned that can help. That will help. You can be proactive on that so that you can try to get some of that mobility back before you have a major problem.
Wonderful. That was great. Those are all the questions we have for today. So I just want to thank everyone for joining us today. The webinar recording will be available to rewatch within a week. Please call our office for an appointment at 410-210-4562 or visit our website at drcianci.com to book online, and that's drcianci.com. Thank you for joining us for the webinar today, and have a great day.